WHOW will be on site broadcasting live from 3 till 7 that afternoon. Our live coverage is brought to you by our title sponsor, Enel Green Power's Alta Farms Wind Project, committed to creating long-term shared value for DeWitt County communities. Learn more at enelgreenpower.com.
Your John Deere is here. Now is the time to grab your Sloan deal and save big during deer season. Like our John Deere Z500 Series Z-Track mower with a high-capacity mower deck and Comfort Glide seat. Get a new Z500 with 4.9% APR for 60 months. 4.9% for 60 months. Some restrictions apply. See Sloan Implement for details. Offer ends 5/2/22. How will you make the most of your mow? Find out at Sloan Implement today.
You're listening to The Morning Show, streamed by clicking the WHOW live icon at DeWittDailyNews.com.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube. It's brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest on the phone in this segment of The Morning Show is Tony Kirkman, Executive Director of the Piatt County Mental Health Center. Tony, a good morning to you, sir. How are you today?
I'm well, Seth. How are you?
Doing good. Thanks for asking. And as always, thank you so much for making time for us. We really appreciate you doing that. And as we talk here for this morning, Tony, we were catching up before we got started about just some of the things that have been on your radar lately. And I always like to have these conversations about what professionals in various fields are, reading into personally. What have they been into in terms of, maybe it's not directly correlated to what they work on when they're at the office, but, maybe they're reading about something and it intersects with what they do professionally. What has that been for you lately, Tony? What have you been reading about? What's been on your radar that you're keeping an eye on these days?
Well, a myriad of things. One of the things that has jumped out to me is that the Centers for Disease Control recently listed their numbers for the 2020 deaths from drug overdose. And so they're looking, I believe, from the time frame of October of 2020 to October of 2021. And so one of the concerning stories there is that they have been able to list 105,752 deaths that have been attributed to drug overdose. Mm-hmm. And when you kind of put that up against what does 105,000 people look like? The city of Peoria's U.S. Census numbers is 107,000. So you're talking about essentially the entire city of Peoria being lost in 1 year due to substance overdose. So quite concerning. So reading a little bit about that, reading about some of the stuff that, speaking of substances, reading about some new experimental things that are happening with the treatment of post-traumatic stress disorder. There's some pilot programs that are out there that are talking about the introduction of hallucinogenic mushrooms as part of a way of treating PTSD. So an individual would participate with using the hallucinogenic mushrooms and then slowly try to reprocess past trauma, so that while you're cognitively going back to a memory, you're also emotionally kind of attached to it and doing some reprocessing. So it's a new breed of medication assisted recovery or treatment. So kind of interesting on that part. And then there's just a plethora of material out there that we continue to have a sense of emerging mental health distress and depression, specifically with our youth, but it's being experienced all over the place.
Going to your first talking point there, Tony, about overdose deaths, we know that during the pandemic, those greatly increased, and we've talked about it, you and I, especially on this show, that, substance, maybe not substance abuse per se, but, and maybe to some degree that's true, but, substance using alcohol and now legalized, say, marijuana or other illegal drugs, using those as a coping mechanism through COVID went up throughout the pandemic. How about that component, Tony? And what about the pandemic caused that from your perspective?
I think you're exactly right. It's concerning. We've seen roughly a 30% increase in people's self-reports. So, it's significantly higher than that, of people saying that their use of substances or alcohol usage has increased during the pandemic. What we saw was that, especially in the early stages of 2020, going into 2021, is that COVID had brought in a lot of things that were unhealthy. Is we were told to stay inside, stay away from our social supports, and the unpredictability about things. Is whether or not people like to admit it or not, we like patterns. We do better in predictability because when things are predictable, it gives us the illusion that we're in control. When that is taken from us, and we don't have predictability or the belief that we are in control, what we call an internal locus of control, it causes a lot of things to exacerbate our anxiety. And so how do you treat that? Well, you take essentially a depressant that brings down your respiration, cardiac activity, and you're chemically soothing yourself instead of learning other less damaging coping strategies.
Mm-hmm. One thing as you're talking there, Tony, I'm curious about, because I know, again, our guest on the phone today is Tony Kirkman. He's the executive director of the Piatt County Mental Health Center, and the morning show, again, streams to Facebook and YouTube. It's brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. I'm curious, Tony, what happens like physiologically, in our brains and other things when we do things like exercise, or we go like we take up a hobby that is good for us and things of that nature. What happens there that that anxiety component comes down with those things? How about that?
Yeah, no. So again, the brain, while very, very complex, some of the components are very, very easy. Is what is rewarded is repeated. And so what we can do is the brain actually will create neural pathways, and we desire that dopamine hit, that feel-good neurochemical that says this is a pleasurable activity. And so one of the things that you're exactly right, Seth, that helps is when we exercise, the body creates these endorphins in our brains that help dull pain, help increase mood, help our respiration, which helps us, in the combating of anxiety symptoms. And so there are a lot of things. You're starting to see a lot of movement towards mindfulness because the body can be trained to cope with certain stressful behaviors. And mindfulness is a big one, like yoga or just meditation, of trying to figure out, we're having a physiological reaction. How can we behavioralistically address those and help it with our cognition?
Mm-hmm. Interesting. When it comes to, Tony, increases in anxiety and depression, you mentioned to me before we got started that, we had thought that perhaps as, kids get back to normal, especially in Illinois, where, kids aren't wearing masks to school, they're not wearing masks when they play sports, things like that. When they go places, they don't have to wear masks anymore. We thought that perhaps that would lead to a decrease in some of these things. And maybe it's a residual thing where like over time it will slowly go down. But you mentioned it's not perhaps dropping as fast as we had thought. What do you see in there?
Yeah, well, I mean, what I can give, because the data is not there completely, is that from my own personal experience, I have got a junior high boy and a fourth grader. And what I can tell you is that both in their reports and what they are observing with their colleagues is that we're continuing to have high levels of anxiety and stress. And And one of the things that was concerning for me is that my own son, he found comfort in the mask. And there had been times where we had been walking outside or at other outdoor events, and he wanted to keep the mask on. In fact, it was very difficult for us to encourage him to try going without the mask to school. What I found it to be, and this is poor terminology, was the mask was serving as essentially a pacifier. It was helping reduce some of the anxiety, and it was a self-soothing thing because he could hide behind it. All of that, in my opinion, not healthy.
Mm-hmm. And I'm sure your son is not alone in that. So, is it healthy to, you said it's not healthy, but, how about trying to break that habit? How do we do that?
Well, I think that for me is I try to meet my son's self-narrative, what he's telling himself, with truth, with objective truth. And that's been the problem with COVID. And I know we could probably spend a whole segment on, I have my truth, you have your truth, and I can find, I can be a self-fulfilling prophecy or what we call in counseling a confirmation bias. I can find the material that backs up what I think. And so I think sadly there's been a big disservice to the community where we haven't had an objective, non-biased presentation of what COVID was. And so, I was just reading a news piece this morning that there's yet another variant that's out there that's contagious, and we're talking about what we should be doing in preparation for that. And at some point, we're just going to have to figure out how to move forward and live with this virus. Wisely, of course, but I know that's a long answer, but I think the best thing I can do, Seth, is I try to meet his self-narrative with objective truth.
Mm-hmm. That's probably a good approach, across the spectrum with things of the challenges of that nature. So good discussion, Tony. Great discussion. Let's take a time out here. How do folks learn more about the Piatt County Mental Health Center?
Yeah, give us a call, 217-762-5371. Or check us out online, piattmhc.org.
That is, again, Tony Kirkman, Executive Director of the Piatt County Mental Health Center, our guest on the phone. The WHOW Morning Show streams to Facebook and YouTube. It's brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. More to come on the Morning Show.
New trucks and SUVs are coming here at Baum Chevrolet Buick in Clinton. This is Scott Baum. Yes, we have new inventory arriving, and you can see what will arrive right on our website. Just click on the pre-order and reserve tab. From there, you will find vehicles in transit and vehicles in production. Or just call our sales staff and we'll help. Find Silverados, Equinoxes, Blazers, including Tahoes and Suburbans, as well as our complete Buick line of SUVs. BaumChevyBuick.com. Right from the start.
MR Systems Wireless has an immediate opening. They're looking for a full-time internet installer to perform the initial setup of wireless internet and voice-over IP services, as well as troubleshoot and repair wireless and phone services for customers. You'll be responsible for the basic installation and maintenance of wireless equipment. No experience necessary. Includes health benefits, mileage reimbursed. Starting pay is $15 an hour. Find out more and apply by going to mrsystemswireless.com, then clicking About, then Employment. Equal opportunity employer.
Despite supply chain issues, your Clinton Save-A-Lot's great team of ownership and employees are working to keep their shelves stocked to save up to 40% every day. Read owner Dave Jackson's State of the Supply Chain post by clicking their icon at DeWittDailyNews.com.
Peterson Insurance Services in Clinton is a 2014 Pekin Insurance Illinois Agency of the Year. Jay Peterson here from Peterson Insurance. Find out about Pekin's auto, home, or life insurance by clicking on our icon at DeWittDailyNews.com.
Thank you for listening to this Miller Media Group radio station. We appreciate you making the choice to tune in to us. We want to remind you of some things to keep the attorneys happy. Our stations allow one winner per household in a 30-day period. Cash prizes are mailed to our winners within 30 days of winning. And as you've probably already guessed, portions of today's programming on this Miller Media Group radio station were pre-recorded and are mechanically or digitally reproduced. There. Now we've made the attorneys happy. Thanks again for listening to this Miller Media Group station.
You're listening to The Morning Show, streamed by clicking the WHOW live icon at DeWittDailyNews.com.
Once again, a good morning. Thanks for being with us. I'm your host today, Seth Lawrence. My guest on the phone, Tony Kirkman, is the executive director of the Piatt County Mental Health Center. And Tony, as we talk here for this morning, I know you're watching. It's legislative season in Springfield. Lawmakers are putting together bills they hope to get passed before the end of the legislative cycle. I think the end of next month, if I'm not mistaken. But be all that as it may, what are you watching, Tony? What's on your radar as you, kind of monitor the happenings in Springfield?
Well, one of the big things, Seth, we're watching is always the budget. The budget is one of the things that under Governor Rauner, as he was trying to be fiscally responsible on certain initiatives, sadly, social services was one of the things that took a big cut that affected us. Governor Pritzker is making a pledge to not cut services to Illinois and to actually expand some of these services as we move forward into fiscal year 23. So right now, and it's just a crazy amount of money when you start thinking about it, but there's a $1.16 billion that is being proposed to go to the Department of Human Services, with $705.3 million going to the Division of Mental Health, $388.8 million to the Division of Substance Use Prevention and Recovery, and then $70 million going to the Behavioral Health American Rescue Plan Act appropriations. So what we're seeing is the governor is holding the line, or he's actually increasing some spending. I think I saw somewhere where even the Department of Children and Family Services is scheduled to get about $300,000 more in funding. But, sadly, the Department of Children and Family Services has been making a lot of headlines for all the wrong reasons in our news. And so hopefully the funding means better streamlining of services, improving access to care. So the budget is the big one that I'm watching. There's another one that's out there that's called House Bill 1592, and it's the Mental Health Inpatient Facility Access Act. And it's very, very, without getting too much into the weeds, it's really reimagining the way that state-operated mental health inpatient systems are done, with training, a pretty good accountability tool that's back there. One is just to try to clear beds and to make those available for individuals that require inpatient treatment. Mm-hmm. Again, if anybody that's listening has ever tried to access inpatient treatment, they know that it's extremely difficult from a mental health standpoint and very, very cumbersome from a substance use standpoint, requiring some people to either go completely out of their service area and in some cases out of state to get services, which is quite sad.
Yeah, for sure. So it sounds like some good initiatives then. I mean, you're talking about increasing funding and increasing access, which is really the biggest probably hurdles in dealing with mental health, emotional wellness, substance abuse, treatment, all those things.
Yes. There's also a substance use overdose prevention program that the governor is launching through an executive order that's working on social equity framework for a multi-agency collaborative model on how Illinois deals and prioritizes issues related to essentially opioid overdose numbers. Again, I shared with you a larger number of how our nation's had over 100,000 overdose deaths in 12 months. But here in Illinois, the number of opioid overdose deaths in 2020 increased by 33% compared to 2019. So we really need to be engaging the communities of color and those that are in depressed socioeconomic environments. So Governor Pritzker is making some initiatives through an executive order to address that, as well as one of the things I'm very interested to see how it lays out is that just yesterday he announced that he is appointing David Jones, who currently is the director of the Substance Use Prevention and Recovery Department in Illinois. He's appointing Director Jones to the role as Chief Behavioral Health Officer, which is essentially a behavioral health officer that will be operating out within the governor's office to help coordinate behavioral health administration and policies as it goes through many different state departments like the Division of Mental Health, Human Health and Family Services, DCFS. It's trying to bring all of these programs into the same room to see how we can collaborate and deliver services in the most efficient, effective way possible. So that's exciting.
In 20 seconds, can you tell me how you feel about some of these things?
On paper, it's great. I think it's fantastic. I think the proof is in the pudding, right? We're going to have to see some wins, and a lot of people have gotten very accustomed to silo delivery, which is sad, but I'm hopeful. Let me end with a note of positivity. I am hopeful that this will work.
Tony Kirkman is the executive director of the Piatt County Mental Health Center. My guest on the phone. The morning show streams to Facebook and YouTube. It's brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Network News is next.
With SRN News, I'm Rich Thomason in Washington. This is the second day of Senate confirmation hearings for Supreme